Really? Yeah.
So we're going to get started. I'm glad you're here. This is more people than we were expecting, given how exhausted everybody is. But welcome, and we're glad to have you. So we're going to be talking about how to build a story for advocacy, very specific. And we hope that some of you will leave with stories where you go, oh, I love this story. And some of you will leave with I know what a story that I love is like, and I've got a story that is part of the way there, maybe most of the way there, or maybe halfway there, but you have a sense of how to get it there. And one of the things we're going to ask you to do is build a story while we're doing this. And this is true in the Zoom as well. And then if you either send it to me, folks here need to send it to me by email. My email will be at the end. Folks on Zoom can send it to me by email, but some of them may have it built in the chat by the time they're done because they're all operating on chat, right? This is an attempt to see if we can actually do a hybrid. And I kind of would love it if people could kind of be more toward the aisle. So those of you who are hiding on the far aisle, if you want to leave at some point, I am not going to be disappointed because it's not actually going to be more disruptive if you scoot over 5 chairs to leave than if you scoot over 1 chair. Okay, so I have used stories a lot. One of the things I use stories for is the New York Health Act, which would bring Medicare for all for New York. It is a fabulous bill, and in fact, Bernie Sanders' bill and Jayapal's bill used it as their base text. Just to brag a tiny bit, because our assembly person worked on it from 1993 when the New York State nurses came to him and said, we need this. So as part of the lobbying for that, another league member and I spent most of a year writing stories for a local newspaper that were all healthcare stories, about 1,000 words long. And then we shortened them to put in a book for a hearing before the New York State Legislature. So we have some of these, if you'd like to take one or look at it. You know, they're really nice stories. If I did it again, I would do this book differently. I would lead with the stories rather than leading with all the upfront frontispiece stuff. Stories are actually what gets attention. Can we move it? Oh, I can move it. Clicker. See if the clicker works. Where do I point the clicker at?
Big green button.
There we go. Okay, so the agenda is, why do we use them? What's the structure? Let's do a personal story, and then do stories and advocacy. And I will send you these PowerPoints if you have given us your email. Our objectives. So why does good advocacy need storytelling? What's a good story? How do you craft it? And then let's think about how you strategically use stories in lots of different kinds of advocacy. That one's going to get shorter because this is actually a 90-minute to 2-hour workshop. We are doing it in 60 minutes. Fine, we're the league, we can do it. Okay, so what's the value of telling stories? And I want this, so the Zoom people are going to write it in chat, and one of you guys is going to just read out what they're saying, whereas Linda or, well actually Susan probably can, right? Those of you with a mic need to be able to read it out so everybody hears it. Okay, so in this room, what's the value of telling? Why would you tell a legislator a story? If you were canvassing, why would you tell some person on the front door a story? Go ahead.
Because people respond to stories, not data.
What? How do they? What does that mean? What is it they?
That means that people emotionally connect with stories and it motivates them.
So it's like an emotional bridge.
Exactly right.
Okay, we have one over here.
She stole my thunder.
Okay.
People repeat stories.
Oh, stories are more memorable than data is. Oh, interesting.
And
Okay.
messages are embedded in those stories.
Oh.
It makes a more direct connection to what you want and how that's going to affect more than just you.
So it's not just an emotional bridge, it's a policy bridge that has a personal feeling. Somebody else? I saw more hands, I think.
We have some answers on chat as well.
Mine's a little.
Okay. Actually, in the future, what we may do is I have you shout it out and I'll repeat it.
Humans need that connection with each other, it's primal. And when you tell a story, it's on a really deep level.
Ooh, we will come back to that.
We have some in virtual too.
What?
Things be memorable and relatable. They bring issues alive. Yeah.
It's on.
And stories would be memorable, relatable. They would bring the issues alive, and they capture a personal attention. And they need to care more about what you're saying.
Good, right? We all agree. Okay. So guessing what you would say, humans bond through stories. Check. Building trust means telling what motivates us. A story reveals who we are and why we're telling it. Stories open the door. Emotional bridges, activism bridges, policy bridges, moral bridges. It is amazing how much a story reveals. Well, they just do. And stories explain why I'm doing this, and people trust you more if they know why. Just a fact. So, one thing you need to know about advocacy stories is that other people are also telling stories. And even though as a league member I do not believe in otherizing folks, when you're telling stories, it's really good to talk about heroes and villains. So while I am talking about heroes and villains, let's be clear that you don't want to paint the other side as an awful, terrible monster, but you do need to understand who's on the forces of good and who's on the forces of darkness, because otherwise it's not a very interesting story. So, okay.
I may have skipped one.
I may have skipped one? Let's see. Okay, so people are telling stories about you, right? So, Cinderella and Aesop's fables, Bible stories. Where do we learn these? How soon do we hear these? Really early. People are saying, if you are, if your family is that kind of family, you'll start hearing stories when you're 6 months old, right? And you certainly start hearing stories when you're 18 months old. And you're actually even told to tell stories and repeat stories by the time you're 2.5. They are a way of learning language. What about the Odyssey and Gilgamesh and Paradise Lost? What kind of stories are those besides super long? They all started orally. They were told around campfires. And there were specific structures to them so that the bards could remember them forever, right? And they got handed down. And then only eventually, well, Paradise Lost not so much, but Paradise Lost is a Bible story and that got handed down. Okay, so what else is true about those? They start in the middle because a really powerful story does not start at the beginning. I mean, fairy tales start once upon a time. Epics, which really matter morally, start in the middle. Why? It grabs your attention. That's where the drama is. And it's only after you hear the drama that you want to know how it got there. And then you want to know how it turns out. What about elevator stories and short pitches? What are those?
Attention grabbers.
Yes, they are clickbait. Oral clickbait. Exactly. Do you need to know how to do that?
Yes.
Because if you give somebody clickbait, then they'll give you a little more time to finish your actual story. Okay. So, I've often done this for relatively young people. I ask them to tell a story. This is one of the stories when I was doing it for some very young people. This is a less than a minute story. Turning 26 terrifies me. At 18, I was diagnosed with Crohn's disease. I could attend college only because my dad spent hundreds of hours researching treatments and specialists, booking appointments, fighting for my coverage. On my own, I would have been lost, homebound, and humiliated. The worst day of my life was also the most expensive. In other developed countries, my health care would have been fully covered with doctors helping me manage my complex care. In New York, it is an ongoing and terrifying struggle. I want the peace of mind enjoyed by citizens in peer countries. Comprehensive health care that's affordable for everyone. That's why I spend time every week advocating for New York Health and Medicare for all. Will you? What do you think? It checks the policy box, it checks the personal box, it checks my dad's the hero box. I mean, who doesn't love a story where my dad is the hero? Okay, next one. My husband died after 600 days in the hospital. Sometimes he woke in terror, desperately pulling out his IVs and monitors. I'd awake to a cacophony of beeping. He would cling to me, scared and guilty, terrified that his care had bankrupted us, leaving me homeless. He knew the dangers of medical debt that even great insurance gives out. No one who's sick should agonize about paying for care. His medical team told me his terror is common. We were fortunate for his Cadillac insurance, covering bills over $2 million. But even with great insurance, for desperately needed care, fully covered care, I faced denials. Now I advocate for the New York Health Act. Will you join me? 1 minute. This kind of story works really well when you have even Zoom advocacy. 6 or 7 people, 1 person introduces it, 2, 3, 4 people tell a story. Inside 15 minutes, you can change the mood of the lobbying. It also works if you're canvassing door by door, which I don't do anymore, but I know people who do. Okay, so what's the structure? They all have heroes and protagonists. They have villains and antagonists, problems or conflicts and a crisis. They all have a solution. Now these 2 columns are essentially the same thing, but I use different terms because on one side it's their characters, and on the other side it's our characters, right? And I don't really care how you label them, but every story, whether it's for you or against you, has these. So, for New York Health, for example, and you all know what Medicare for All is, so who's the hero of the side who hates Medicare for All? You need to know what the story your opponent is telling. Who's the hero? What?
Family doctor.
Family doctor, who else? Insurance companies that are giving you actual choice, right? Because choice is a wonderful thing in the free market. Who else? Ordinary people are the heroes, right? Who's the villain?
Insurance companies.
No, for the insurance, for the people who are, what is the insurance company?
Big government, big government policy.
Big government. Who else? Socialists. Any Medicare for All thing, socialist is going to appear as a socialist, and socialist sympathizers is going to end up being part of the villain. What's the problem? We don't have enough free market. There's too much regulation. Big government is causing this. If only we got government out of the way, it would be better for everybody. Or doctors are greedy, or ordinary people use too much health care, or
Too expensive.
legal stuff. Yeah, you know what it is. But you can see it when you watch either ads or commercials. What's the solution for the other side, for the opposition?
More privatization.
More privatization and the status quo. Yes, okay.
Regulation.
What?
No regulation.
No regulation, yes.
Protection from malpractice.
Protect, yes. On the margins, there's all these things that we can do. Okay, if you're going to be telling the story from the good guy's side, you know, right. Actually, the league is in favor of single payer. So if you're going to tell the story from the league side, who's the protagonist? Who's the hero? Ordinary people who need health care, meaning everybody. Who's the antagonist? Now, those of you who've been watching me during the last day and a half of forum know some of my antagonists.
Big medical companies.
Big corporations that are for profit. We can have any number of antagonist villains. It can be big insurance. What am I supposed to, oh, I'm not in the picture, fine. It can be big insurance, it can be hospital chains, it can be
Big farm, big farm.
big pharma, oh yeah, big pharma is a big one. It can be private equity. There could be all, what?
It's both for-profit and not-for-profit.
Well, for-profit versus not-for-profit, but I will tell you that in my area, Long Island, right outside New York City, the largest employer in New York State, the largest private employer, is Northwell Health. It is one humongous nonprofit hospital complex because healthcare facilities in New York must be nonprofit. The CEO earns something like $9 million a year without his bonus. Bonus in addition. And it spins off so much excess profit that it has its own venture capital firm inside this nonprofit. So, we do need to discuss the difference between a corporation which has investors and a corporation which does not have investors. There is no way that Northwell Health is a good representative of the kind of mom and pop doctor organization that Betty Keller from Vermont likes to favor. You know, with the porch and the shingle, and he's there at night and you just knock on the door, that kind of guy. Yeah, Marcus Welby is not Northwell Health. So there is an issue about what not-for-profit means and how to define it. What's the crisis on our side?
Medical debt.
Well, medical debt is a really big one. What else? Access. If you're speaking from a league perspective, since the league goals are equitable access, rationing doesn't work. Affordability. So medical debt is a villain. Comprehensive care, which means you sign up for Medicare Advantage, but you can't get cancer care because it's too expensive. You can't get preventative care. So you want good care. So yeah, look at the league guidelines, the goals and the healthcare position, and that will give you what the crisis is. What's the resolution? And for the league, it might be Medicare for all, it might be the New York Health Act, which the league supports, or it might be smaller medical reforms. For example, coverage for all in New York under Medicaid. It might be providing doulas in every county because we have some healthcare Medicare deserts. But there's a lot of different resolutions depending on what you want. So, you know, we went through this. You actually did really well. Thank you. And you'll get this on a PowerPoint. Good. Okay, so some choices. Battle of the stories. You figure out who the roles are and which way you want to play this story. In a 1-minute story, you don't have a lot of time about the other side. If it's a 5-minute story and it's like, 400 or 500 words, you might be able to start painting the other side of it, of course. Begin in the middle of whatever the most dramatic moment is. Do not be afraid of emotion, but don't name the emotion. Display the emotion. That's really, really different. Don't tell the values. Explain in a way that reveals the values. People will get it. And have an ask. If you are using it for advocacy, always have an ask. Know what you want the person to do. Failing to ask completely misses the point. Okay, exercise 1. So because we're going to do this trying to be good to the 100 people, we're going to do exercises 1 and 2 in the same space, so that after we finish the explanation, the Zoom people are gonna be put into breakout rooms, I hope each with a coach. And the coaches are gonna figure out how many breakout rooms they need and how to do this. But each breakout room should have a monitor, should have a timekeeper and a scribe. And in this room, I'm gonna ask you to be in groups of 3 or 4. So look around you and figure out how to sit next to 2 people or so. Okay, or 4, I don't care. 3 or 4 is probably right, 5 maybe too many, 2 you're gonna get bored. Okay, so sit close together. I'm gonna give you an assignment. I want you to take 2 minutes for the number 1 and 8 or 10 minutes for number 2. That 8 or 10 gets slightly longer, but not too much longer. Do we have questions? Yeah. You've got a mic there.
The folks in the virtual rooms also can see their assignments.
Good, okay. So we're going to have you individually draft a 6-word story. Then we're going to have you focus and share a longer version of that 6 words. Okay, okay, so the Zoom people have in the chat, I hope they will open up instructions for exercise 1. You guys get handouts. We have no idea how many people were coming. Number 1, it's all those. I don't know this quite enough. So every small group gets at least 1. You're going to be writing 6-word stories. So the question is, can you tell a story in 6 words? Well, there's some examples on the handouts. But the coach in the Zoom pointed out to me last night that Hemingway had a lovely 6-word story. This is Hemingway's story. For sale, baby shoes, never used. How do you feel about that story? Emotional. Yeah. Okay, let's try to repeat the story. This is Hemingway's 6-word story. Baby shoes, for sale, baby shoes, never used. I mean, it sends a chill, right? And you kind of want to know more, right? Okay, I want you to do the 6-word story to focus yourselves. Okay.
What is something?
You have 2 minutes to write 6 words. It doesn't have to be perfect.
And if everyone can hear me in the virtual space, I did put the exercises up that you can open the Google Docs. The 6-word stories, exercise 1, and then the longer version of that is exercise 2. So I think we should start with 1, and I'm going to put us into breakouts so that we can discuss those. So just give me a moment to divide the group of 33 people here into 3 groups of 11. Stand by for a moment.
So I'm going to suggest that your small group take 1 or 2 of the 6-word stories that you like best. Ask the person who wrote them to give you the 15, 20, 30-second version. Coach them on how to make that version better. Remember, we're looking for emotion. We're looking for a villain or some problem that causes an issue. And then you're going to make a policy statement really quick. This is not the whole story. What are we going to do about it? After the person has done the 30-second and you kind of make it a little better, go to the next 6-word sentence, story, and try to make it better. It would be nice if we had time for every single one of you to get through this process. Pick the 2 that you were just proudest of and your small group. Okay, okay. So I realize that not all of you are just about ready to spend another 20 minutes on this. You don't have it. What we're going to do now is we're going to ask for a few stories from the Zoom world and a few stories out of this world.
Judy, just give me a minute to get everybody back.
Okay, go ahead.
Yeah, give everybody like 30 more seconds in your room.
So you all have 30 seconds to figure out who in your group might share, and then you're gonna move you're gonna move one person to share. Meaning both worlds join. Don't read it, tell it. We're gonna do 2 or 3 out of this group and 2 or 3 out of Zoom. 1 minute maximum. You are telling it, and we don't care if it's perfect. We want it to be dramatic and end with a policy ask.
Sorry to make you force you to say that.
End with a policy ask. Connect it to what you want. And ask. That's why you know what policy you're on.
Is resulting to
Could have been, could have been.
Absolutely. Thanks, yeah, people are coming back down. I gave them 60 seconds. Joining the space and in the next 10 seconds.
Okay, you guys got 10 seconds. Okay, so one from me. And you guys, we're gonna ask for 3 stories. So lean on the person you think has a great story. And there's no requirement that you share. It will work better as a workshop if at least 3 of you share. Just want to put some guilt out there.
I'd be willing to share.
Okay, let's hear your share.
I had a really great breakout group, and boy, they just launched right on this.
Okay.
So my 6-word story is grandson nearly died from diabetes. The other story is he was airlifted from an emergency room to a specialty hospital with glucose so high it could not be measured. At the hospital, he received good care, and he's doing well. His hospital bills, even with good insurance, were so high that my son and daughter-in-law are still paying them off after 13 months. The ask is, what happens when he is not eligible for his parents' insurance? And we decided that our audience for this story was a legislator.
Okay, that works. That works. Okay, thank you very much. Nicely done. We might applause, please.
I had a great group.
So I'm going to spend 30 seconds just because that was such a good story. The opening grabs you, right?
Yeah.
And then you need to say something, probably, how to get to the villain. Although the hospital stabilized him, his parents were left wondering how they were ever going to pay the bill. They thought they had great insurance. They did. But the co-pays were, I don't know, pick some, or unaffordable. They are still paying them off. We need health care that is affordable for crisis intervention. Saving lives should not be about losing your house or your retirement. Right? Something like that? Okay, fabulous. Let's take one in this room. Go for it.
Okay.
Go ahead.
Okay. Our 6-word sentence was, my son still needs a kidney. And then our story is, he was born with congenital kidney disease. Because insurance would not initially pay for any tests, he was not diagnosed until he was 4. By then, the medication for treatment cost $15,000 per month, and the insurance would not cover it. His kidneys failed. He still needs a transplant. His life-threatening situation was completely avoidable. Please support Medicare for all to include unlimited access to preventative care for all.
Wow. Wow. How old is your son?
We made this up.
Oh. You do realize that when you lobby, they're going to ask you questions like that. So while we have purposes of this fund, you also know that Medicare pays for long-term kidney disease. Because many people may not realize that a 20-year-old can be on Medicare with end-stage kidney disease. Okay, virtual world. I want true stories from now on. You're inside the rules, you win. So.
Would one of these breakout groups want to offer up their story? Go for it. Rita, I think you're muted.
Andre, if you want to stay
Is that better?
go ahead.
Yeah, great, Rita. Go for it.
Okay, so we had Corolla 2010 for sale, niece cannot use. She was highly depressed, self-medicating, and because she did not have and could not get or pay for health insurance, she overdosed. So, since I live in Missouri, and they refuse to accept federal funds for, to help with Medicaid and Medicare, we have dropped so many people from the rolls that there are more and more that just do not have health care. And in this situation, my niece ended up dying.
Well, and one other thing you said is she's left a 9-month-old baby.
She did. She left a 9-month-old daughter.
I would describe that as a pivotal detail to put in. What is your closing statement on this? Nobody should die because they do not have access to health care in the richest country in the world.
Or no one should become an orphan.
No child should become an orphan because their mother did not have health care. Pick anyone you want. Well, we need to have health care. It is not people who, catastrophic health care is important. And by the way, chronic disease is important. And behavioral health is a chronic disease. Don't tell me it's moral problems. It's not. Either that or, if it's moral problems, the sacrament should all be taken out and strung up by the judge. Maybe they should anyway. Okay, thank you so much. That was well done. Should we applaud? And we are so sorry. We're not sorry for the fake one. We are really sorry. Right?
Yes, this
We
one's
are
true.
so sorry. Okay.
Oh, we've got one here.
My friend was shocked to receive a $5,800 bill in the mail for her emergency visit after bitten by a cat. After a slew of tests that she received, the doctor recommended her to get a rabies shot that was $2,500 alone. She felt she was taken care of until she received the bill, which caused her great distress and anxiety. No one should be put in that situation. All patients need to be informed about the cost of care they are receiving. Will you join me to fight for the No Surprise Bill to be enacted? Which this incident actually happened before California governor signed the No Surprise Bill.
So No Surprise is a Surprises are partially a function of privatized medicine because they have to do with emergency room doctors being bought up. And then once you get a monopoly on emergency doctors in an area, you hike the price, you cut the number of doctors, and you cut the kinds of care. So no surprise, and then you get a surprise bill because they're out of network, right? They're in no network. So no surprises is really important. And a cat bite shouldn't do that, should it? Okay, do we have another virtual one? I think we have 2 more, and I'll wrap up really fast. Because you like these stories?
Yeah.
Yeah. Can you imagine telling them to a legislator? Yes. Do we have another one? We have 3 more here, so I'm willing to go inside. Okay, we're going to take you over here. Who is the lady? This lady right here. You've got a cheerleader.
Are we sure that nobody else in the virtual space wanted to share? Just double checking. It was just quick. Okay. All right, go for it, Judy. I just wanted to double check.
Guns shatter lives even when they don't kill. My brother was standing outside of Penn Station in New York City when he got hit by a stray bullet one evening in August. 2 weeks before, he had ridden his bike 60 miles. His thigh was shattered. He needed emergency surgery, obviously. And the news reports reported this nationwide, that this guy was randomly shot outside of Penn Station in New York. But the news stories ended with the victims expected to make a full recovery. Well, he hasn't. There's no way he's going to fully recover to the person he was before that gunshot hit him. So what we're doing is we are asking our legislators to support having the CDC and other relevant agencies to dedicate resources to study the human impact of gun violence.
It's hard to applaud that, but yes, you deserve applause.
He's doing okay. I mean, he has some good things. He found a girlfriend.
He's doing okay. I mean, but it's not, we have to think of beyond, full recovery.
Full recovery doesn't mean just you live.
Yeah.
So, thank you. Applause, please. Anybody else in virtual space? We now have lots and lots of hands pointing at one person over here in physical space. Okay. Go for it.
Thank you. Okay. If my stepmom doesn't marry my father, she will never be given the opportunity for work-sponsored insurance. Although she's had a decades-long career in the restaurant industry, working every day to serve others, she will always be living in fear of the next medical emergency. Please support Medicare for all.
I might suggest, that's very good. I might suggest with something like, if she worked in restaurants, she got hurt sometime.
Yeah.
My mother sliced her finger while cutting vegetables. My mother tripped while carrying a tray that probably weighed 50 pounds of dishes and whatever else she was carrying. I don't know how she did herself, but pick something. Her first thought was, and start your story. So start it at a moment of drama, so the person remembers not just that she happened to work in a restaurant and she doesn't have health care. It does help that she is thankful to be marrying my stepfather, because, right? Do you want one? Okay. One more and then I've got to wrap, because, just because we're the last thing doesn't mean we have to.
Mine's a little imperfect, so it still has room for improvement. My 6 or 8 word thing is, my teen trans daughter's life is now in politicians' hands. Another 8-hour car trip for a 15-minute doctor's appointment. I was shocked when my daughter came out as trans to my wife and I. We immediately accepted her for who she was with all our love. Rejecting her was not an option. Love won. My governor and the Republican legislators decided that they knew what was best for my daughter more than us. Now we have to travel to Minnesota for gender affirming care. Please ask your legislator to support gender affirming care in Iowa.
Okay. We're getting heartbreaking stories, right? Okay, I hate to say this, but as an advocate, that's the best kind. I mean, nobody should go through tragedy, but if you go through tragedy, try to make it valuable for something. And one thing I might say is, you might want to say, legislators who are politicians do not understand healthcare, and few of them understand trans children. They don't have them in their families, or they would not vote against this. So I mean, I would make my villain a little bit worse.
But I will have to say, I discovered when I was lobbying that one of the Republicans who was adamantly actually did have a trans.
One of the Republicans had a trans child, of course. You know, like was filled with irons. Okay, I want to go to the last slide. If I can. I don't remember what the last slide is. The last slide is basically how would you use them? You could use these at a lobby day. You could use these at town meetings when you're talking to a legislator. You can use it at a community or educational event. You can insert a story if it's short enough in an awful lot of public places. You can do a really good story in 1 minute, right? We've just demonstrated that. You can make it even more powerful in 3 minutes if somebody gives you the time. But 1 minute will absolutely capture attention and make your point. And let me tell you, the more you tell your story, the better it gets because people respond, you see how they do it, you get more fluid. This works. So go forth and advocate, and thank you very much for coming. By the way, if you want to see our booklets,
And share your email. Thank you, Susan.
Janet.